Yeah, it's been a long day. I hope all of you are still alive. Okay, so I feel that finally I can have a chat with you all, and I have Yvonne with me here. We're going to have like a sort of like a conversation rather than me just blah 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 blah. Yep. Hmm. Well, I think Yvonne needs to turn on her mic.
Oh, hello.
Okay, so I know some of you have known me from ages ago. Yes, my history back to my uni days. I think one of my friends is there. Yep, that's right. And now she's a special ed teacher in one of the special schools in Singapore. So, and then a few of you are from SPD. That's where I last work. And then from Rainbow Center as well. So, hello everyone. Yeah, so maybe I start with brief introduction of myself and where I've been and my experiences, just to give a little background of where I've been and where I've arrived, and so that those who don't know me yet can know me a little bit. Yep. So I started Summers Therapy Services in 2015. Yep. That's before that I was in SPD. I was there for nearly 4 years with the early intervention program, as well as the continuing therapy program, where I work with school age children. Yep. So my experiences has been with the really young ones as well as the older ones at school age. And before my time in SPD, I was in Rainbow Center. That's where I serve both the school side as well as the EPIC. So I also have quite a bit of experience with children a few months old up to 18 years old, and a variety of diagnoses like autism, Down syndrome, cerebral palsy, global developmental delay. Yep. So that's me. And I graduated from Melbourne La Trobe University. So before that's where I get my speech therapy degree. And before that, I actually did social work and psychology in Singapore. So yes, I don't know why you want to laugh.
So you have to explain to us what happened, what made you do speech therapy, why psychology, and
Oh,
then
oh
what
yes.
inspired you?
Okay, so I don't know, I just always have this interest in social work and psychology in in helping professions. Yeah, so my A level results was not very good. So I could one of the options is either the science faculty or the arts faculty. So I'm not a very science person and I wanted the helping profession. So it's social work and psychology. Yeah. And then when I was doing psychology, I studied, there was one module called linguistic psych, and they talk about languages, grammar, language disorder. And then I was like, whoa, that's really interesting. And then when I went on to have my social work placement, that was in CPAS. That time it was called the Spastic Children Center. Spastic Children's, I think. Wow, you know my era now. So that was when I came across a speech therapist, and she was working with a child with cerebral palsy. So, children with cerebral palsy, they are often physically quite impaired. So they are very limited mobility. Yeah, but yet, um, the speech therapist was able to elicit from that child a lot of communication. So when we use what we call the AAC, the augmentative and alternative communication system, I realized that there's so much in that child that is waiting to come out. And the glitter in that child's eyes, I'll never forget. Yeah, so I thought like, wow, this sounds more interesting than social work. As a social worker, I always do like financial assessment, whether this family qualifies for means testing, whether I can help to apply for NTUC vouchers. Not that social workers are not important, but yes, they are important. Yes. If I think you unmute your mic again. Yeah. Yeah, so social workers are important, but I thought maybe that's not my calling. Yeah, I mean, I always wanted to work with children with special needs. That's why I chose a social work placement in a special school. Yeah,
Do you remember what the child said, the first thing?
I can't remember.
What?
I was too distracted by the fact that physically she was not even able to really sit on a chair for her to actually actively use her hand to use the communication system. So she has to be like lying reclined on an adult's body so that she has that, that little bit of movement for her to communicate. Yeah. So that was really interesting. Yeah.
So it
So
was
anyway,
that placement that made you do speech therapy.
yes, that's right. Yeah. And then my social work supervisor, so she arranged for me to do speech therapy observation with the speech therapist. And then she wrote me a recommendation letter for me to apply to uni to be a speech therapist. So it was my social work supervisor who sent me off to be a speech therapist. Yeah. So that's how I got started. And then there's no turning back. Yes. So yeah. So maybe I share a little bit about how I started Summers. When I was working in an organization, I realized that as a clinician, we get very bogged down by administrative matters in organizations. So it's not uncommon for us to, after a certain years of experience, your big boss will ask you, so do you want to continue to be a clinician or do you want to be a manager in something, Those who in the social service sector will know. Huh? Your mic. Unmute your mic.
This is the time that I should mute myself.
Yeah, by the way, Yvonne came from a social service sector as well. Yeah, so I was asking myself, what do I really want to do? Oh, one of our ex-colleagues, Haslia, said through that. Okay, so I have a lot of supporters here. Yeah. Anyway, so to me, I'm a clinician at heart, and I really want to work directly with the kids. Yeah, and I love supervising newer, less experienced therapists to work with the children, so that there will be a succession and more children can be seen, can be supported. Yeah. So I said I don't want to look at the financial reports. I don't want to look at payrolls and all that. Although that's what I'm doing right now. But I still do a lot of supervision work and I get to know all my children in Summers. I do all the initial assessment with my therapist. Yeah, so I'm in all the group chats with the parents. So I'm always on top of how the kids are doing, what they come in for, whether we're achieving the goals. Yeah, so I think that is what I really like to do. So I started Summers.
How did you decide to start Summers? Like one day you woke up and
Yes.
let me start Summers. It's a breaking point after a certain years of experience.
No, it's just thought that I just want to be a clinician, and how do I be a clinician? Start my own
Go
clinic and
start
start to see all,
Summers.
start to see all the kids by myself.
So
Yeah,
now the important question, what does Summers stand for?
like the 4 season summers. So some people say like, oh, why do you call yourself summer? Are you summer? Why do you call yourself summers? Are you summer? So well, some people have suggested that could be my English name, but I've not gotten used to that. So I only use it exclusively for non Mandarin speaking parents who has difficulty pronouncing my name Hui Ting, so they can call me Summers. Yes, that's right. But Summers is not really my name. Yeah, okay.
Okay, I think we have an attendee who is raising her hand. Maybe
Okay.
she would like to speak. I don't
Let
know.
me press this. Okay. Hey, hi, April. April would like to say something. Yeah, I've allowed her to talk if she would like to unmute herself and ask any questions. Maybe we give her a second to have her question.
Okay, meanwhile, while April is unmuting, maybe I can also ask you some other questions that we've gotten in. Oh, all the clinical questions here.
Yay! I just share my experiences. I'm not like the expert. Okay. All
Where's
right.
the mute button? I shall mute myself. Okay.
Disclaimer.
So we have one question, which is, my child is 2.5 years old, and he spits out food sometimes. Example, macaroni and porridge with vegetable cubes like potato and carrot. Why is that so?
That's a really huge question.
So a child who is 2.5 years old and spitting out food sometimes. Why?
So usually by about 2 years old, the child should be able to eat all the different kind of table foods that adult eat. Just that you need to actually cut it down a little bit into smaller size. So it's not so what I call normal to have a child spitting out food. Did they say, is it just the veggie,
So they say, example, macaroni and porridge with vegetable cubes. Vegetable cubes like potato and carrot.
Okay, so when you think about food, we always look at three different areas. One is the taste, next is the texture, and then also the temperature. So have to think about whether the child is okay with the taste, whether it's too bland, the child doesn't really feel the food, doesn't enjoy it, doesn't want to eat it, doesn't just spitting it out as a communication for you to let you know that I don't like this food, it's not good. Or it could be the texture. When you think about it, some kids doesn't like porridge texture, which is a little bit mushy, or another kind of porridge, which is Teochew porridge, where it's quite solid pieces of rice, but with more liquid in it. So that could be a double texture that the child may not know how to manage. So the child could swallow the liquid, but yet spit out the pieces of rice. Yeah, and then we also think about the texture of the veggie cubes. If it's like potato or carrots, whether it's mushy and sticky after the child chews on it. So the child may not like that texture. It could be a sensory thing. It could be a motor thing that the child cannot manage that texture and want to spit it out. We also look at the temperature. Sometimes the food is a bit too cold, or the child is taking too long to eat until it's cold, or maybe it's too hot and the child can manage 2 bites and then spit it out immediately. So these are the things we look at. And we also look at the child's oral motor system, whether the child has enough strength and skills to sustain enough chewing, enough number of times of chewing for the food to break down before he can swallow it. So when you think about chewing, you actually have to use your tongue. Once you put the food in the middle, you have to push the food to the side, to the molars. And you have to keep your tongue at the side on the molars with your cheeks. Keep the food there to sustain that placement for chewing. So if the child has got oral motor issues, the tongue is not strong enough to keep sustaining the side position, or the cheeks are too soft, can't keep the food on the molars, then you won't have enough chews for the food to break down enough for the child to swallow. Yeah, and also the tongue movement, the tongue needs to gather all the food around the mouth, make it into a bolus nicely, like a ball of food, and then push it backwards to swallow. If the child can't do all this, then most probably they will spit it out. Yeah, so there's a few factors to think about.
So in general, when a child is spitting, would that be a cause of concern then for the parents?
Depends on how often the child is spitting and when, and depends on the frequency and what kind of food. If the child is doing it across most of the food, then I'll be really concerned. If the child is doing it only for some food, then still not too bad. So you can think about what is the properties of the food that the child may be spitting out. Yeah, so At about 2+, I'm not sure whether the child has been exposed to outside food as well. So some kids, once they start eating food from the outside, which is much more salty, a lot sweeter, they might find food at home a bit bland and start not wanting to eat those. Yeah. I mean, besides that, also there could be a behavioral component. Like also they just want to see your response, how you respond once they spit out the food. You could be like, don't do that, da, 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 da. It could be an attention thing as well. Who knows, like you could be watching your phone while you're eating with your child, and then your child is eating by himself, and the child spit it out, and you give the child attention. So the child is like, oh, that's how I get mommy to connect with me and pay attention. So let me do that a few more times. It's so fun, So something to think about.
So maybe just to finish off on that question, for that parent, what would you recommend as good foods for a 2.5-year-old to be giving a 2.5-year-old child?
What are the good foods to give?
What are some good maybe examples of food that you can present to a 2.5-year-old child that is suitable for them or good to promote oral motor?
I think, see, it sounds like what the mom is giving is quite good, like porridge, macaroni, cut up veggie cubes and all that. Yeah, it's more like how it's presented at this age, where there's a lot of articles on the internet saying that, how you can make the food really cute looking to encourage the child to eat more. Yeah. So
okay.
so
April, April would like to ask, my boy who is 7-year-old, sometimes when he is watching the cartoon, not violent or the fighting kind, he will cover his ears and eyes with a hand or pillow or go to the room to stay for a while to avoid the screen. How to train him to overcome this?
That's a really good question. Watching a cartoon, not the violent or fighting type, not the very loud type, I suppose, and not the very flashy type. Yeah. To avoid what the screen, how do we? Yeah, I think I don't have enough information to understand why he will be doing that. Not sure whether it's something that he has watched before and he could anticipate something scary is going to happen or something shocking is going to happen. That's why he wants to hide away, wait for that scene to be over before he comes back, or whether there is some sensory processing thing going on with him. Yeah, so I do not know the answer to how do I train him to overcome this. Yeah, so I think it would be good to watch it with him if it's something that he anticipates that's coming and is scary, to hold him tight, give him the comfort and the security that, mommy is here with you, there's no need to be scared. The deep pressure is always coming, so it might help to regulate him a bit. Yeah, or at that certain part of the cartoon, you can pause it if that's possible, and then just say, the scary part is coming, well, what do you think the bear might do? The dog bark very loudly. Yeah, so it's scary. Are you ready? Until he's ready, then maybe you can put it on play again and let him watch the next segment. Yeah.
I'm curious to find out why also. I mean, he is 7, so can also ask why.
Yeah, if he verbally can explain to you.
I think we have a Vic who would like to ask the next question. Maybe can I give him permission to speak?
Well, I think she wrote that there's no function to speak when we ask question. I think once you raise hand, I can allow you to talk. I have this button here that allows to talk. So let's test it with Vic, because I know Vic from a very long time ago. Yes. So you can unmute yourself. Hi, Vic. Okay.
Hello.
Yes. So that's how it works. So you can ask question like this.
Okay, just now the question regarding the chewing food, I think is earlier my question. Yeah, so just to further add, right, is it appropriate for my son, right, to sit on high chair, and then that's when I feed him. And then I think I noticed that when he start to spit things out, it's not immediately after I give him the first mouth, then he will spit, but it's more like maybe along the way. I'm not too sure, is it because he's also full already, or he's just like tired and don't want to eat. And then because I noticed that at certain point, right, he will actually what do you call it, like maybe half an hour later, after eating, if he haven't finished eating, then he was sick for like want to watch video and all this. Then I have to use another method to engage him, because he always need to be engaged when he eats.
I'm a little bit concerned when you mentioned that he has not finished eating in 30 minutes. Yeah, because we try to keep meal times to about 20 minutes. So I'm a bit, that could be a sign that he doesn't have enough oral motor skills to manage the entire meal, and spitting out could be a communication to tell you that I'm too tired to do it already. So yeah, it's good to get a speech therapist to check out.
Okay, so because early on, he has seen a speech therapist, so there is like that suggestion of sight chewing, all this. Then because I think there's a few factors I noticed, like if you give him his favorite food, like fruits, any kind of fruits, he eats very fast. If it's like that also can be like apple cubes, he can chew on his own and eat very fast. If it's things that maybe he doesn't like my food, also it's because it's bland, so he will choose not to want to continue eating. But if he sees me eating my mixed rice, and he will request for it and mix into his porridge or his macaroni, right, he also eat faster as well. So maybe I'm also still trying to evaluate the root of problem. Is it because he really don't like my food, or is it really he has oral motor issue, or he's just very fussy in food selection?
There's always a reason why kids are fussy with the food. It's either a sensory thing or a motor thing, and most of the time it's a combination of both. Okay, so when you give him your meal, which is a little bit more tasty, it gives him more oral awareness for him to manage the food, and more motivated to keep eating. So as mentioned previously, we look at the taste, the texture, the temperature. I think these are the factors that seems to be playing a part in that.
There's one feedback from teacher recently during the parent-teacher meeting, that he also eats slowly in school. So yeah, in a sense, so I mean, it's like there's certain timing that school has for feeding. So I think at the end, they let him eat first, then at the end they also feed him, because of the time. They commented he eats slowly. So I'm not too sure whether is it again fussy of food or whatsoever, because just yesterday I let him try the kind of like maybe bigger pieces of meat, right? The sweet and sour pork. He likes to eat, and he keep asking for it. And it's quite hard, right? So yeah, so to be mixed into his like porridge. So in a sense that maybe he's seeking for a stronger taste.
Yeah, stronger taste, and also more sensation from the food. Because when you think about sweet and sour pork, the texture, and you say you give him a bigger piece, that will give him a lot more awareness of what is happening in the mouth. When he has more awareness, then he'll know, oh, that's what I'll do to help myself chew and swallow the food. If you give him like a very bland piece of food, then he'll like, what's that in my mouth? Do I feel it? Do I not feel it? What do I do with it? Do I chew it? Do I not chew it? So there's a lot of factors that could be impacting on it. Yeah, and I think school food is also quite bland, if I'm not wrong. And they'll give I've seen give runny porridge to 2+ 3 years old. So that's a factor as well.
Would you suggest that he sits on high chair still, or he should be like his food should be on the ground?
On the ground. I would give him, at this age, I'll give him a small table and a small chair. Yeah, it's also a good time to practice self-feeding. That will give him a sense of autonomy, like, oh, I have control over my meal time, how much I put in my mouth. Yeah, in terms of self-help skills, it's a good time to learn self-feeding for this age.
Yeah, he's learning. He can self-feed if he likes the food. But he doesn't like food, he'll make you feed him. So, and with the
I think it's the same for
motivation
me. If I see like KFC and pizza, I'll self-feed very fast.
Like with a motivation of watching a video, that will even add in more motivation.
Yeah. So sometimes, from my experience, I also have kids who really need a video to keep eating, because once they have too much awareness of too much mindfulness of what's in their mouth, then they'll like, oh, I have to mindfully chew this piece of tasteless vegetable, or this mushy potato that's cooked until really soft and tasteless. I'm not going to do that. But if you give them a video, their mind is off and they're not focusing on their mouth. They will just have a semi-automatic movement to chew, 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 swallow, chew, 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 swallow. Yeah, so there's quite a few factors. Worth seeing a speech therapist again. Yes, and I know personally, you can send me videos.
Okay.
Bonus of being my friend.
Okay, thanks.
See you later, Vic.
Thanks.
Thanks.
Thank you. And I think we have another question. My 6-year-old doesn't dare to flush the toilet unless she's accompanied by an adult. She mentioned that she's scared of water sounds, and we explained to her that, and she also understands that how the flushing system works in HDB flats. But she's still not comfortable. She will even joke that we should shift to stay at the highest floor without water piping.
Tell her there's such thing as a penthouse. I'm just joking.
Oh dear, mom is in panic mode now. Don't worry, mom.
I'm just joking. Yeah. Okay, so I think there's something with the sensory processing. I hear a lot of my OT colleagues talking about kids that they work with sensitivity to certain sounds and noise that is not so-called within their control. So they do not quite know how the whole where the sound comes from and how the flushing system works. Although they know that, oh, it's flushing, it's the toilet bowl. Cognitively, they know, but sensory-wise, they are still unable to process that. Yeah, for speech therapists, I am not quite sure how much we can help, but I think a referral to an occupational therapist to look at the sensory processing would definitely be beneficial. Yeah. So I hope that answers your question. Yeah. It's not easy to, because we also have children who are sensitive to like razor sounds, cutting hair, vacuum cleaners, washing machines. Yeah.
And to answer another participant's question for sensory processing issue, you would recommend therapy with the occupational therapist?
That's right. Yeah. Occupational therapists, they work a lot on sensory integration, sensory processing. Yes. And also regulation. So strategies to help them regulate if they get too stressed out by certain stresses in the environment. Yeah. But also have to highlight that occupational therapists, all of them specialize in different areas. Yeah, so some are more interested in like handwriting, fine motor skills, academic success. Some will be more specialized in sensory processing, regulation, sensory integration. So do find one with experience in the sensory processing area. Yep.
So the keyword is sensory processing.
That's right.
And our next question, with your experience, have you come across children who have language delays and are attending mainstream school? As a parent,
yes,
do not want to miss out the opportunity. Let the person finish the question. As a parent,
so rude to interrupt.
Social interaction.
Social communication.
As a parent, we do not want the child to miss out the opportunity of being with other children his age. He is 7, reads, has some vocabulary, however, he does not use it functionally. He does not follow the class and only participates in activities that he likes, for example, in music. What would you say to the parent as the child is not benefiting from his time in mainstream school and no child, I think child has not gone for any form of assessment or has any diagnosis?
Okay, that's a very big question.
Yes. So
Yeah.
maybe the first part on, have you met children who have language delay and are coping well in mainstream school? And
Yeah.
this part first.
Okay, yes, I do have a lot of kids with language delay and in mainstream schools, and they are doing rather well. Although there are some difficulties, but they jump one hurdle after another. Yeah, sometimes I feel breathless and anxious for them, but they made it through. Yes. For myself personally, I have quite a few kids whom I've seen from young, like 2+ years old, and then they go up to 5, 6 years old, and parents ask me whether should send to a mainstream. If I think that the child has adequate language ability to go, I would definitely say, okay, enroll the child for the year that he turns 7, just like any typical child. But if the child I feel is not ready, and I feel the language gap is too big and the child may need another year or 2 to catch up, I would definitely ask the child to ask the parent to get the child a deferment. So in Singapore educational system, you can actually defer for up to 2 years. So the latest age that the child needs to enter primary school is 9 years old. Yeah, so you can defer for 2 years, work on the language, spend a lot of effort, energy, focus onto the language, and get the child to catch up a little bit more before you send the child into a mainstream school. Yeah. I have also parents who send the child into mainstream and said, I just want the child to experience mainstream, going through the routine, the social interaction. I don't really worry about academic. That's fine too, as long as the child doesn't have stress behaviors coming home. So I've got children who acts out in school, who throw things, hit the teacher, scratches the friend. Then I'll be wondering whether that desire for the child to have the social interaction, just the social interaction in mainstream school is really worth it, because the child is not socializing anyway. He's only going there showing a lot of stress behaviors. Even if you don't worry about the worksheets and the writings, the spelling, the class presentations and all that, the exams, the stress caused onto the child is not worth it. So I'll ask the parents, is it your own desire, or do you think that's for the best of the child? Yeah. It might sound very brutal and crude, but that's really something that parents have to ask themselves. Yeah. But some parents will say, never mind, I'll just send him for at least half a year. I say, okay, yeah, you can do that. There's no harm at all. Just try. Some kids really made it. Yeah. So do it if you really feel that the child deserves the chance to do that. Yes. I mean, the special school settings will always be there to receive your child when you really feel that mainstream, the child is not doing well in mainstream anymore. Yeah.
Yes, thank you.
I hope I don't offend any parents here, but that's from my experience and personal thinking.
Thank you. It gives a broader idea of what we are looking at when we want our children to go to a mainstream school for the experience, or are we looking at the academic track that we want them to get that certificate at the end of the day? So I think it's a good point you pointed out on how sometimes the parents is the ones that feel that they are maybe depriving the child of that experience, and so go ahead and try it out. It's no harm also. But just be on the lookout for stress signals that the child is getting too stressed out by something. Yeah, thank you, Hui Ting. We have another participant who's asked, is it possible to do a mid-career switch to the role of a speech therapist? Right, she says the work is very meaningful. Yes, yay.
Yes, come join us. Okay, so in Singapore now there is 2 different programs for training to become a speech therapist. During my era, there wasn't, so it was only overseas. So now Singapore, we have the NUS Postgrad Masters Program, which is 2 years full-time. Later I'll get Yvonne to share a little bit more because that's where she came from. Yeah, that is for anyone with a bachelor degree in any discipline. You just go for an interview, which is quite a bigger interview. And then they will choose, I think, 20 students every 2 years. Yeah, and they'll train. It's a very intensive 2 years master's program. There's no, very limited holidays, I would say no. There's a lot of placement, and it's really like a full-time job. So there's no way you can say, oh, I just do that and then I work as well. So no, so you have to give up your income for the 2 years and have enough savings to pay for the school fees and your livelihood for the 2 years. So that's the master's postgrad. And this year, was it this year or last year? Last year. So SIT started their bachelor in speech therapy. So that's a 4 years course. Yeah, so just like any bachelor degree course, they have their school holidays, they have their lecture times, it's a little bit more spaced out. So you take 4 years. Yeah, so that program is pretty new. It's just the last year. I think every year there should be intake. Yeah, unlike the NUS program, which they will go by cohort. So after one batch finishes the 2 year program, then they start another batch of 2 years. They don't have a concurrent batches going on. Yeah, so maybe now I'll get Yvonne to share with you a little bit about the master's postgrad.
Yes, go do it if you can. Go for it. But I think maybe just one thing, if you're experiencing speech therapies from what we share today at Summers or getting to know us, there is another part of speech therapy which is more with the adults as well. So when you go for the training, be prepared that we will be working on speech and swallowing with stroke patients, and that is another aspect that sometimes if we are, because my experience was I came from being exposed to children's setting as well, and I thought, yes, I want to work with communication and speech difficulties in those cute little children. And then I was like, what? We have to learn anatomy and we have to learn about the brain, different areas, and speech and swallowing for adults as well. So just know that when you do the course, we are trained in all aspects, not only the children, but also for adults as well. But it's still all very fun. Come, we're waiting for you.
I really like the anatomy, and then previously we also had lab classes where you go and like cut up carcasses and look at the muscles and the brains and all that. Yeah, that was really fun. I did a 4 years program in Australia, so I did 2 bachelors instead of a bachelor then a master's. So in Singapore you can practice with either or a master's or a bachelor. You don't need to get a master's to practice.
Yep. We have another question. Do you need a teacher to be part of your team?
What kind of teacher? You can send your resume to ask@summerstherapyservices.com. I've always been thinking about having teachers, early intervention teachers, setting out early intervention program under Summers, because I think it will give the child a little bit of a more holistic kind of educational support. Parents have also asked us whether we have such services. So I'm still praying about it to see what comes out of it. Yes, do send in your applications. You could be the first teacher of Summers.
Hey, join us. The more the merrier.
Yes. Yeah. I also have this idea of like having early intervention program where the child just come and work on social comm. You know, just come like 3 hours every day to work on social comm and language. And learning routines and language processing for school readiness. Yeah.
Exciting.
So let's think about this.
Let's do it. Come, send in your resume, whoever you are.
Yeah. We're also thinking of having OTs, psychologists.
Any OTs, come, send in your resumes. More colleagues, the more fun.
Yeah. Because now we only have speech therapists and we're referring out our OTs and psych, and early intervention.
Yes.
So let's see where it goes.
Yeah. There is another question that says, sometimes I realize when he plays or focus on doing something, he will drool. Not sure if that is normal. I'm not sure the age of the child, but I guess it's asking, is drooling normal when a child is perhaps playing or focusing on something?
By right, by 1 year old, the child should stop drooling. Yeah, in all activities, all settings, whether the child is focused or not. But we do have children coming to us where they are still drooling after 1 year old and they are wearing a bib, or mom is at the side busy trying to dry out their lips. Yeah, it is a little bit of a concern because that would show that the child is having an open mouth posture. So the jaw is hanging down while playing, while you are doing something. It could mean that the child is doing mouth breathing. And those who have known me for a while, I have a very big concern about children who are mouth breathing because that affects your brain development. Oh dear. Yeah, not enough oxygen. Yes.
Elaborate. You cannot just talk about brain development and stop there.
Yeah, so when you don't have enough oxygen, your brain will not grow well. Okay, so mouth breathing is always a concern. Nose breathing is the best of all because it will clean the air. You will make sure that the child is breathing deep into the rib cage, into the diaphragm area. That's where you get enough oxygen. So if the child is drooling while playing or not focused, could also mean that the child has little awareness of what's happening in the mouth. Like for us, when we talk or when we watch something, even if our mouth is open, when we feel wetness, we definitely do this. We swallow. That's why you don't see us drooling, because we do have the awareness that our mouth is full of saliva or it's going to spill out, that we're going to swallow. So if the child drools all the way out, that means that the child hasn't got the awareness. Yeah, so that's sometimes indicative of a low sensory awareness. Yeah, also maybe low muscle tone, low muscle strength, which that doesn't give enough sensory input of saliva at the lips. And a lot of parents do not know that even if the child doesn't have drool falling off, even your child has got wet lips, it's called a level 1 drool. So that is drooling, even if you don't need to have droplets coming down. Yeah, even just moist lip is considered as level 1 drooling. We should not have our lips wet at all. So that's something to think about.
And the age we are looking at is by 1. That should not be happening.
Yeah.
I have another question here. It says, my child is nearly 3 years old and not talking at all. How can I help him?
Oh, 3 years old and not talking at all. Wow. Okay, so first I have to assess the child and see what are the reasons why the child is not talking. And the other areas of development, especially like before a child starts talking, they will have what we call the pre-verbal skills. So these are skills that signify the child is ready to talk. So things like eye contact, imitation, turn taking, joint attention, visual tracking, auditory tracking. So all these are important skills. If the child do not have these skills, then we would think whether the child is ready for using language, using words, being verbal. Yeah, and if the child has all these skills but still not talking, then we have to look at the oral motor system, whether it is a dyspraxia where he has got motor plan issues. So there's nothing wrong with the muscles. It's more of the brain unable to connect to say those words, or whether it's a dysarthria issue where the muscles have low muscle strength, so not much awareness of how to use these muscles when you want to use these muscles, they're so weak that I cannot move them adequately to form a speech sounds. Yeah, for most of the children that we see, they have a mixture of both dysarthria and dyspraxia. Yes, so we do have to look at the reason for that. Yeah, and then our therapy approach will be different. To answer the question.
I think how can I help him? The first thing was
okay, how can you help him? Send him to a speech therapist, yeah. Because it's really quite concerning at 3 years old. So when you think about normal development, by 1 year old, the child should have, when you talk about it crudely, 1 year old, the child would have single words. By 2 years old, the child would use 2-word phrases. By 3 years old, the child would have used 3-word phrases. So your child is already quite a few stages behind the typical 3-year-old. So I'll be really quite concerned. Yeah, I don't think it's fair to let the child wait and see or outgrow that. You know, you might do that in the previous generation, in our grandparents' generation, or even our parents' generation, to think that. But now with the services available, with the new research and all that, there's no way that we can just say, oh, never mind, he'll outgrow by 5 years old. I also start talking at 5 years old. You know, or oh, once he goes to school at 7, he'll learn how to talk. No, that's not right. That's too late. No, and also you think about the psychosocial part of development of the child. If the child is bright and wants to say something but cannot have the ability to express himself, that would be quite terrible. You can see a lot of behaviors and frustration happening. Yeah, it will not be good for the child's esteem. Yeah, so there's quite a few things to think about here for that 3-year-old. Yes. So see a speech therapist. Yeah. There's no easy solution out. If you are telling me like a 1.5 years old still not having single words, he might be a little bit delayed. You can try more language stimulation strategies at home for the child, but later than that, I'll be really worried.
And thank you, Hui Ting. And just now, I think you mentioned about apraxia as well. We have another question that says, you know, does a child with ASD have apraxia?
Does all the children with ASD have apraxia?
Perhaps.
I won't say all, but from my experience, yes, quite a few of them have it, yeah. But a diagnosis of apraxia is not so straightforward. You know, yeah. So some parents come to me and the child is not saying a single word and tell me that, oh, I went to another therapist and the therapist assessed him to have apraxia. I'll be very suspicious because there's no way you can diagnose apraxia without a child saying words. Yeah, so for me, I'll just say, oh, maybe there's some motor planning difficulties. Like the brain cannot control the mouth to say the word. Yeah, but I won't be able to say, oh, your child definitely have apraxia. It's diagnosed, confirmed, guaranteed, plus chopped in black and white.
Part of the definition is that they have to be cognitively on par.
Yeah, as well. So there's a lot of factors that we need to think about. And the child must say enough words for us to get a speech sample to diagnose it. Yeah.
So I think to answer this person's question, maybe he's looking, is it a direct correlation between having ASD and apraxia? Might not be so clear.
That's right, yeah.
Thank you. And the next one we will have is, how soon should a child who is in transition from an NGT feeding to mouth feed, how soon should a child transit from NGT feeding to mouth feeding? And then a second part is, what are the skills that this child should display before going on to mouth feeding? What kind of food consistency do we start with?
How soon? There's no time frame for us. There's only whether the child is ready or not. Yes, so when you talk about mouth feeding, first the child must be able to swallow. You know, when we think about the child eating something, there's 3 phases. One is the oral phase, whether the child can accept the food, closing the lips, whether the child can push the food to the side, or whether the tongue can make the food into a bolus and the tongue push the food back. You know, that's the oral phase. And then once you push the food back, there's also the swallowing part. You know, whether the child can initiate a swallow promptly. So like if your foot is really close at the end near your airway and the swallow doesn't happen, it may just go into your windpipe, into your lungs. So that is really dangerous. And then we also have after the pharyngeal stage, we have the esophageal stage, where is the digestion part. Yeah, whether the child can keep the food down in the gastric, in the stomach. So there's a lot of complexity in learning oral feeding. So how soon, I won't be able to give you an absolute answer. So once you start therapy, you can see how fast the child respond to to the therapy, and slowly we can and when you think about NGT, right? The most important thing is the nutrition. Okay, so before you can transit NGT, like take the tube out, you also think about whether the child has enough nutrition orally, take in enough nutrition orally. Yeah, so if the child hasn't got that endurance to do that, then there's it won't be so quick to feel a good transition to NGT. Yeah, so I think as long as the health wise is stable medically, and doctor has most of the time doctor will try to get the child to do a swallow study, and if there's a clear for us to do feeding therapy, then we might start the transition. But whether you can win off NGT, how soon it will be, I wouldn't be able to give you an answer. Some kids take years, some are quite fast, so there's quite a few factors to think about. What kind of consistency?
Well, I think maybe in terms of like, even if the child is not ready for NGT mouth feeding transition and weaning off yet, is there anything you can suggest that they start to do, maybe like in terms of being familiar with the food wise?
Definitely you can do a lot of exposure to a little bit of taste, a little bit of texture, a little bit of temperature, but make sure that the child is not given big amount to swallow and get a lung infection after that. Yeah. So we'll recommend massages on the face outside to desensitize the face area. So a lot of children that I've worked with, they are quite sensitive to anything near the face because their experience so far has not been very good with anyone coming near their mouth, their airway. Yeah. So they are quite defensive. They're very scared of people doing anything to the oral and the facial area. So we can desensitize with facial massage. We can do oral massage with the brush, the Z-Vibe, to just give that exposure to normalize the sensation, to prepare the child to be ready for feeding, the actual feeding with food. Yeah, so we call that the pre-feeding therapy, using non-food items to get them ready.
And meanwhile, also just start including, I think some of the families I work with, they're so used to having the child with NGT eat first in one corner. I don't know why it must be always one corner. And then the family eats on their own. So they're not even used to the idea of smelling food or sitting at the table. So if before we establish whether it's safe to transit yet, that may be something we can consider. Also, just sitting together with the family and eating at the same time. So you're seeing food and something's going in your tummy also.
That's right. I think that's a very good point. Like making mealtime something fun and sociable, so that they have a positive association with food, rather than I'm always stuck in one corner and everyone is hovering around me, very anxious about whether I'll choke, I'll cough. And then after that, I'm left aside by myself with maybe the TV on, and then the family will sit there, hee ha ha, and then enjoy their food. Yeah, so that's true. Yeah, so that's a good suggestion. Yeah.
I think to follow up on the previous question about, I think the parent is wondering if a child with ASD might have apraxia, maybe a child who is non-verbal and already has a diagnosis of ASD, maybe what are the chances of, maybe not apraxia, but a motor speech issue with them?
Yes, there's a high chance that a child with autism may have a pre-verbal child with autism. Yeah, may have motor speech issues. There's definitely, yeah. So seeking the right treatment is important. A lot of the most traditional speech therapy approach would be using the hear, look, say method, which is I say you imitate. If you cannot do it, you try and try and try until you get it. Yeah, so that has not been very successful with a lot of children with autism who have got motor speech issue, because first their imitation skills is not very strong, so they may not do what you ask them to do, and secondly, if they really do have motor planning issues, that's really tough. So for us, we do quite a bit of oral placement therapy where we help to tell the child, and we do prompt as well. So we tell the child to open the mouth, how big to open, what's the size of your jaw opening, how to retract your lips for the E sound, how to round your lips for the O sound. So all this need to be taught individually, not just say oo, say oo, say oo, and you repeat it 10,000 times, the child will not look at you, or the child will do, that kind of movement. So there's a lot of children who went through that, and it's really tough.
Maybe just a short question on what is your thoughts on screen time and speech delays or other communication language delays?
Screen time, okay.
And it's linked to ASD.
Oh, linked to ASD. More screen time. Okay, I think that could be the last question that we can do for today. Right? Yeah, it's already 5:30.
So for the others who have asked your question, do stay and we will type an answer for you. Hui Ting will type an answer for you.
And Hui Ting has got teletherapy at 6 o'clock.
Perfect. So she'll type a very quick answer for you.
Yes, you can find my personal phone number on our website. So do WhatsApp me anything. Yes, yeah. Okay, screen time. All right, I call this generation of kids the iPad generation. Yeah, so iGeneration, that's a nice name. So I'm definitely seeing a lot of kids coming to us with signs of autism, okay, because of a lot of screen time, and also a lot of children with autism like to enjoy iPad, enjoy screen time. I think it gives them a sense of comfort that, oh, I don't need to socially interact with people, which I don't really enjoy. So they do enjoy the screen time, but I don't think there's a direct link of more screen time will cause autism. Yeah, it's not causal, but definitely I see a correlationship with more screen time and the signs of autism. Yeah, so children who since young, a few months old, given the iPad all the time is like nearly 6-7 hours a day, having signs of autism, reduced eye contact, reduced ability to interact with adults, lack of social smile, delayed response to name calls. So I do see that trend happening. I won't say that they're autistic. I won't say that they're on the spectrum, but I would say that they display signs of autism. And speech delay, yes. Yeah, because it's a one-way thing. When you talk about speech, you need a two-way, it's a communication. Yeah, so yes, speech delay. The social communication part. Yes. As Yvonne has mentioned earlier. Oh, I see someone saying trans-D approach. That's a big topic. We can take it offline.
Summer's trans-D, come.
Okay.
So thank you, Hui Ting. Thank you everyone who have stayed and asked so many questions. Yes, that was the last question that we'll be answering.